Start again if you don't mind. Good morning, ladies and gentlemen, and thank you for joining us for this press conference. This is my first responsibility as the immediate past president to introduce to you the new president of the AMA. It's my great pleasure to introduce Dr Rosanna Capolingua, who's a general practitioner from WA, who's now taken over as president of the AMA. Rosanna.
Thank you very much, Mukesh. Well, we've just had a very, very successful national conference, and there's been one very clear message that's come out of that, and that is that we as doctors are very concerned about the quality of care that Australians are going to be receiving over the next period of time. We're concerned about, in some arenas, the fact that care is not to the level it should be as far as services in the public sector, in particular in the hospitals. But we're concerned about some of the government's concepts of changing how the profession works, of jeopardising professionalism, which will actually have an impact on patients being able to see doctors. That's the message. Patient care is the thing that is our priority leading up to this election. Health has hardly even been seen on the election profile at the moment. Everyone's worried about the environment, education and industrial relations, and the AMA needs to put this issue, patient care issue, right at the top of the agenda again. As part of that, we have elected a new team. Actually, one phase continues, and that's the Chairman of Council, Dana Wainwright. But I have with me also Dr Gary Speck, who is now my Vice President, and Dr Sam Lees, who is the new Treasurer. Some good talent from across the country, some experience indeed, not just at clinical medicine, but experience in the AMA, understanding what's important.
And what do you think you're going to make? How would other people describe you?
We called a few things this morning. I am inclusive and I listen. I can cooperate, but I'll draw a line in the sand as well.
What were your impressions of the great debate yesterday, Tony Abbott and Nicola Roxon? Do you think Medicare is safe with both of them or either?
Medicare, the name, will stay. What they do underneath that, I think, is yet to be shown. There were some commitments to fee-for-service medicine, and then there was some, but at the same time we can do some sort of circular funding around that. I don't think we really know yet, particularly from the opposition. We haven't seen a health platform that's very clear. And the current government, we need to see what's new for them too. There'll be probably a new health minister if that government's re-elected, and that is always a new ballpark.
They were both quite negative about the 7-tier structure.
There was a flat no, really, wasn't there, about 7-tier structure? You know, 7-tier structure is something we've been pushing for quite a while to try and manage the way that we have been billing our patients under the Medicare rebate system to make it a fairer process to reflect what work is done. But I think that we have to remember that the doctors have to do the work and deliver the services and bill appropriately, being sensitive to the patient's abilities to pay. And then the government has to work out what rebate they have to pay. They've taken on that job of being the underpinning insurer, and they need to make sure they take that job responsibly, index it appropriately and have a commitment to it.
So do you think you'll have to go back to the drawing board on the 7-tier structure and put up a new proposal to whoever the new government is?
It's very hard for people to even understand the 7-tier structure. I think even governments and bureaucrats have trouble understanding it. And I think there's some resistance because there'll be difficulty in implementation and selling the message. Perhaps they need to leave that bit up to us. Just do the implementation.
The big question, will you be going on a polypedal?
There's been talk about Lycra already this morning.
I think Mukesh said you'd have to, didn't he?
I might look better in Lycra than he does, but I don't know about Lycra. Don't want to put me in training already. Have got a very large market, they have a lot of power, and they are also interested in cost containment. And this is a clear message to them that doctors are not interested in managed care proposal from private health.
You mentioned some issues with the professional issues for doctors. What's the problem there? What is the federal government introducing?
The current COAG reforms which are looking at national accreditation and registration, which in fact will be taken out of the peer review process that we have always upheld and put into the hands of government and control of government, gives us great concern. When we as doctors look after ourselves, as in we benchmark ourselves, we review ourselves, we ensure that we are up to standard and maintain an ethical stance and professional stance where patient care is first, then we know that we're going to keep going and keep those priorities right. When government comes in to control, the priorities and agendas are different. They are about cost savings. And indeed at the moment they're using a workforce shortage in the medical profession as an excuse or a reason to blur the very important role of the medical practitioner into other allied health providers, and similarly blurring the allied health providers as well. Nurses are fantastic and we need them in their core and they're essential, and they should be able to continue the important role that they have. Similarly with the physiotherapists, the dentists, all the other groups that provide care to Australians. Let's reinforce their roles and make sure that Australians can access them properly.
You're basically saying no to any kind of cash substitution.
This is where the underpinning message of the National Conference came out about quality care for patients. We believe that task substitution puts the care of patients in jeopardy.
Rosanna, sorry, you're talking about the private insurers. They're already kind of offering packages of care to people.
That's right.
Are you saying that you're actually opposed to that?
You just have to look at managed care in the United States to know that we don't want to go there. Again, the reason being that when the private insurer starts to create contracts around the care, the patient's choices are taken away, greatly reduced, and the clinical choices that the doctor makes are then affected by that third party, the fund holder. What we're about here is ensuring that the relationship between the doctor and the patient is always about what's best for the patient, not about the other party.
In what ways practically has this already happened though?
Indeed, even at the moment with the extension of private health insurance benefits into outside of hospital processes, we can see that the private insurers are beginning to advise patients what care they should have, recommend to them who they should access, put in place, in fact, if they view them at risk, methods of managing their care. And in that process, they've actually cut out the doctor, or the GP or the primary care physician who normally looks after that patient. Now, you know, they all believe that these things are efficient, but I want to know, and I know, that they won't provide the better health outcomes. What they're efficient in is saving money for the insurer. We're all into preventative medicine, and that activity needs to be increased, and we need Australians to understand even more and live a life that's healthier, but make sure that we do it in the right context of what's best for Australians.
Can you tell us a bit about yourself and what your achievements so far professionally have been?
My greatest achievement so far professionally is that I'm actually a GP, so I live and breathe the real world of medicine every day, and I very much love what I do. I feel very fortunate to be able to interact with patients on a daily basis and have them share with me the most important parts of their lives very often. It's a humbling experience and it makes you really know what you're about as a doctor, and I think that's essential. And all the clinicians in Australia who interact with patients have that experience. That's what keeps us grounded. Apart from that, I've had a very active role in the AMA, and certainly I'm very proud that the AMA continues to uphold an ethical stance, upholds the profession from that point of view, makes sure that doctors have something to aspire to and to abide by as far as their professionalism goes. And I also have 3 children, all of which are doing medicine.
There's some being